It's showtime. Good afternoon. Good afternoon. Thank you all for waiting for us. If you know the life of a doctor, you'll understand why we are this late, which is really just half an hour, to be honest with you. My name is Janet Silvera. Thank you so much for your patience. Thank you for waiting for us. This evening, or this afternoon rather, I have with me Dr. Janine Morris, and she is a consultant psychiatrist, and Dr. Conrad Curlew, who is managing director of Radiology West and also a consultant radiologist. Am I correct, sir? I hope I have
Correct, ma'am.
given you the right title.
On spot.
Ah, praise God for that. So, October 1 is here. And we are going to be talking about breast cancer and the impact that it has on us as Jamaican women. Now, this is a topic that is very dear to my heart, not because my mom died of breast cancer, she died of colon cancer, but because I know that there are so many women in Jamaica that are having issues with breast cancer. So many women have died as a result of breast cancer. Many of them don't find out until very late, when it's too late to do anything about it. Some of them can't afford to find out anything about it. In fact, research shows that in 2022, over 7,000 Jamaicans were diagnosed with cancer. Of that amount, 1,000, either 1,500 or 1,300 people were breast cancer patients. Now, it means to me that our numbers are going up. So we must do something about it. We're going to be joined as well by Dr. Delroy Free, who is a consultant surgeon and has performed many, many surgeries for women with breast cancer. We lost Dr. Morris just now, and she's driving again. So we're going to ask Dr. Morris to stop driving and start speaking to us.
Okay.
Yes, about breast
I'm
cancer.
pulling into the hospital now.
Yes,
So,
Doc, but we have to stop because we have so many people online.
waiting for us. Okay.
You're waiting on
So,
security to open the hospital
I
gate?
am no. I am in the hospital. I'm just gonna pull over right now.
Okay, fantastic.
Sorry
Thank you
about
so
that.
much. We
I am
understand.
and I must say I appreciate that the listeners have waited for such an extended period for us to get sorted and settled.
By the way,
Um,
incidentally, Dr. Morris's mother died from breast cancer. So as much as I am interested in this subject, and you who are watching are interested in this subject matter, it's very, very, very close to her heart because it came to her doorstep. Right? Right, Doc?
yes, correct.
Good evening,
Okay,
Jacqueline.
sorry.
Good evening, Jacqueline, Danisha, Angela, Joy Matthews, Blessed Child, Benny Cook, Jarubi, and
All
Dominique
right.
James have all joined us. Let's see if we can get
Wonderful.
Dr. Frey.
Alrighty. So I've parked. I see Dr. Frey has joined us as well.
Yeah, but we're not seeing his photograph. So I'm thinking that his internet is not as good. All right.
Okay.
So
All right.
Dr. Morris.
Yes.
Many Jamaicans get cancer, not just breast
Yes.
cancer, but their family members will never tell them that they have cancer. For instance, when my mom was diagnosed,
Yes.
there was no way that I was going to tell her that she had breast cancer. Let me tell you why.
Right.
She would have died immediately, I believe, because it
Yeah.
would have had such an impact on her psychologically.
Yeah.
Tell me
Yes.
what it is that we go through when we get such a diagnosis, and how does it
Right.
affect us as it relates to us not going to be tested because of this.
Right. So generally, when it comes to any chronic illness or any illness at all, the first thing that you would think of is fear, because it's really fear that paralyzes us and makes us say, "Oh no, I don't think I want to know if I do have anything." So it tends to be a lot of fear and anxiety that people experience. And as a result of that, they tend to avoid because, when we avoid things rather than facing our fears, it's more comfortable. And in so doing, you just feel as though, okay, well, I don't need to know. I'm fine. I'm okay. So, fear and anxiety are definitely the first things that people think about when it comes to screening for any type of chronic illness, whether it's cancer or any other illnesses. But now we're speaking about breast cancer. So, generally, for women, I would say that those are the first things that probably go through your head. Now, we are women and we know that our physical appearance has a lot to do with our self-esteem, the way that we carry ourselves, because we attract men by being sexy, wearing lipstick, having a push-up bra and all of these types of things. So generally the first thing you're going to think about is, oh my goodness, am I going to have to lose my breast? If I don't have any breasts, or if I have implants, or as they say, fake boobs, how am I going to survive? Is my husband still going to find me attractive? Am I still going to be able to engage in a sexual relationship with my partner? Am I still going to feel sexy about myself? Because can I still wear low cut blouses and those types of things? So that's another thing that affects us as women directly, in terms of the fact that our outward appearance, a lot of the time, has a lot to do with our self-esteem. It really shouldn't be that way, because we should, have that inner sense of self, but based on societal norms, and you guys on the live and so on would understand what we're dealing with, but based on societal norms, it is a lot to do with your physical appearance. So those are some of the things that women think about straight away, right up. And then, depending on what position that woman has in society, whether she is a broadcaster like you are, if she's a mother, she may think that her role now, she may not be able to play her role in society as well, because you're going to be thinking about, you're going to have surgery. You're thinking about, okay, after the surgery, you probably have to get chemotherapy or some type of radiation therapy. And those things come with another set of complications that you have to deal with, that again affect your self-esteem. Most commonly with chemotherapy, patients lose their hair, and sometimes people put a lot of emphasis into their hair. I need my hair to be styled in a particular way, or if my hair is cut low, is somebody going to judge me or think badly of me? Radiation also can cause your skin, the areas of skin that they put the radiation therapy on, can become darkened. A lot of people, especially in the Jamaican concept, it's a lot of skin bleaching and so on goes on. So, if my skin is going to turn black and ugly, as I'm putting it in parentheses, people may be concerned about that. Again, physical appearance. And if you're not able to conduct your normal role, you may be weak. So you are mummy to 3 or 4 children, and they are saying, "Mommy, we need this. Mom, we need that. Mom, can you help us with our homework? Mom, can you, and you just, because of the chemotherapy, you may be very weak. You may be unable to conduct those roles. And again, because of societal norms, we as women feel good about ourselves when we can look after our families. We are the ones that do the nurturing, and we gather what the men bring, and we make a home out of whatever it is that we're provided with. So when you are now sick and confined to bed and those types of things, you feel like less of a woman. And those are things that are very debilitating in and of itself, in an emotional concept, as well as physically, as a result of all of the treatment modalities that are.
I'm going to come back to you. I'm going to come back to you, Doctor, ask you about whether or not you know of any women who have lost their men as a result of the fact that they have lost their hair, the breast is gone, and they're not as attractive. But I want to talk to Dr. Curlew. I don't know. Dr. Frey, are you hearing us?
Yes, I'm hearing you.
I know you're hearing
us. I'm hearing very well.
Oh, all right.
I'm hearing very well.
So, okay, yes. Let us go to Dr. Frey then, and we'll come back to you, Dr. Curlew. How does that sound?
Sounds good.
Dr. Frey, Delroy Frey, what is the magnitude of the problem here that we have in Jamaica with breast cancer?
All right. Good afternoon, everyone. It's a pleasure to be here. Let me give you some statistics. I'm a scientist. The incidence of breast cancer in Jamaica, about 2-3 years ago, it represents about 43 per 100,000, with a lifetime risk factor, of a woman, of somewhere 1 in every 12 women, lifetime risk of getting breast cancer. Noting the incidence has reached, I've seen a new data where it says 50.2 per 100,000 population. But let me tell you what scares me as a doctor. When I was an intern in 1985, not to give away my age, but the patients that I saw with breast cancer were patients who were early 50s, going up middle age. It's frightening now. Most of the patients I am seeing are patients in their early 30s, between 35 and age 40, 45. Now that's frightening. And if you think that is even frightening, look at this. The patients we are seeing are the early, when you detect this thing very early, the patient get the worst case disease. Let me put that in perspective for you. We check what we call their immunohistochemistry, their receptors. And we're finding that these young patients are negative for all the receptors. And that's a poor prognostic factor. In fact, there's no way you can predict these patients, so we have to pull out the full gamut of what is necessary to treat these patients. So for me, that is frightening. And what is even more frightening, I'll give you some more local experience data. I track from the beginning of the year, January 1, right up to the end of September, and this is a sole surgeon looking at his result. I diagnosed 19 patients who came to my office to be seen for this problem. And what I found is that of those 19 patients, only about 5 of those patients had early disease that you could intervene right away. The other 14 patients required chemotherapy before treatment. I know that in some jurisdiction, probably all patients they give chemotherapy, but these patients represented what we call locally advanced breast cancer, big mass with axillary matted nodes. And that by itself is not good. So what we had to do was send them for chemotherapy. And I can tell you one thing, I don't want to jump the gun with your question. We have a good setup here where we start our chemotherapy and these patients get good response, and then we can, move towards surgical treatment. So to put it in a picture, what I'm seeing now is I've seen between when I was a young surgeon up until now that it almost appears like there is an epidemic of this disease. And the question we have to ask ourselves is this: what makes this difference? I don't know if you want to ask me that question or just leave it there for thought thinking process. And that is very concerning. In spite of all the education that we embark upon during breast cancer month of October, we are seeing patients presenting late to us. And that's a big
Are
concern
you
for me.
saying, Dr. Frey, that even with the public awareness, all of what we're doing here right now and getting people to go and check, it's not making a difference?
Well, I mean, it does make a difference, but I am really concerned that even with this, I'm seeing, all right, 19 patient, 14 patient present with advanced disease in 2024. I really didn't expect that. And that's a small...
Why are they waiting for so late?
All right, that's another part of the question that I've investigated. And you know what I've found? There are a lots of myth here in Jamaica concern breast cancer. A lot of myth. And I'll tell you the first one.
Mm-hmm.
A lot of women don't want to do mammography because they say once they do mammography, it squeezes the breast and it predisposes them to cancer. There's no evidence that supports it. And the radiation you'll get from that, I mean, Conrad is here with us. We can talk about that. It's a myth. So that is one. A lot of people in Jamaica, and in fact, these 14 patients, when I interview them, I asked, why did you present so late? They realized that something was wrong and they had a fear. You know what they had a fear? They had a fear that if they are diagnosed, they are going to get chemotherapy and radiation therapy. And almost every one of these patients, they tell me, Dr. Frey, I know somebody who got chemotherapy and radiotherapy, and soon after they die. That's one myth that is out there that is not correct. And I'll expand on that.
You have had successes with radiotherapy.
Oh, absolutely. We can talk about it. Absolutely. It works. It works. And in fact, what I want to tell you, we have a system set up here, in Montego Bay, where I can proudly say that our breast cancer patient, in terms of diagnostics and treatment, chemotherapy and follow-up, it's as good as anywhere else in, people like to compare first world country. It's as good. Almost home now. I clear the heavy part of the traffic. I'm almost home.
Nice.
You still can hear me?
We're hearing you. And what you are saying is so critical at this point that we cannot afford to lose you. Because you're saying that you're saying that we have the facilities, we have the modern technology to be able to work with breast cancer patients at this time, just like any first world country. That's what you're saying.
Absolutely. And I want to make another stronger point. If I were to throw this question to the audience right now, and I'll ask the question, do you think we can prevent breast cancer? And if I were to throw that out and take a survey of what people will say, and I believe a lot of people will say, "Oh, we can't."
I'm gonna post it here.
The question is, the question is, do you think we can prevent breast cancer? That's a lovely question to ask.
It is.
And why I want to ask that question, because yes. Now, what we can do, you see, from an early age in your life, and in fact, we could spend some more time and talk about risk factors who are at risk, etc. But at an early stage in your life, if you have a family history, predominantly, that indicates that there's a familial history, you can do a gene study early in your 20s, and it can identify the gene that predisposes you to breast cancer. And there are other genes. And guess what? It's not even a blood test. It's a saliva test that you can do. And the current cost for this, and it's available right here in Kingston, Jamaica, it's about 80,000.
What
Yes.
happened to Montgomery?
No, but I mean, it's a saliva test. They are planning to come here to collect samples and to test it. 80,000 to tell you, look, I am at risk of developing this disease. Then, if you have completed having your children, we can operate and you do what's called a skin sparing mastectomy. We remove all the breast tissue. You can put an implant in, or you can use your own tissue. And you remove all breast tissue. And that would really remove the risk of getting disease. So the truth is, from a theoretical perspective and also a practical, I'm not telling you something that is esoteric, is that you could prevent the disease. And it's not very costly at all. And I want to explain something more, Janet, which is very important. If we're able to identify the disease very early, and Conrad will talk about his imaging that can pick up these things early. We can biopsy these things without have to make any big cut. You just can use needle biopsy. We can mark the area, remove the area, and preserve the breast, and follow it with whatever modality, radiation, chemotherapy that is necessary. And we have had patients who have done this and doing very well. And you might ask me, what your listeners might ask, so Dr. Frey, that's nice and good. Give me some idea of what survival you're talking about. Those early patients, I'm down here about 40 years now. I've known patients who we have treated who are approaching 40 years survival. So I'm saying to you, it's not something that you have to be frightened about. And well, the word cancer frightens people, but there are treatment modalities, but we just have to be aggressive and to be very cautious in how we approach this thing, and it makes a difference. And even sometimes, there are some patients, one of them, they are afraid of surgery, they are afraid to lose their breast. We can reassure them that we can do what's called oncoplastic surgery, where you can remove the major part of the tumor, reconstruct it, and preserve the breast. So there are several things. So when we see our patient, depending on their psychology, their emotion, we can discuss different treatment modality. And the other thing I want to mention, which is very important, because patient tells me this: doctor, I don't want to do this. I know somebody who got chemotherapy and they were dead within, a year, or radiation therapy, and they were dead within a year. Let me tell you something. The treatment of breast cancer in patient, it's individualized based on one, your age, based on the stage of which you presented, based on your histology and your immunohistochemistry, and then we plan your treatment around those modalities in order to give you the best outcome.
That is why early detection is important.
Absolutely.
But what are the things that people should be aware of, though? In other words, what should I be looking for? What are some of the things that will literally give me an idea that I might be having breast cancer?
All right, there are
early stages.
All right, there are various risk factors that are out there. And one of the strong one is your familial history. If your mother or your aunt from, the maternal side or even paternal side has breast cancer, you should be much more vigilant than someone else who doesn't have that history. However, I want to hasten to point out that the vast majority of patients, and this might be a little bit frightening, that we see with breast cancer are what we call sporadic presentation. And when you look into their history, and we develop a score when we take that history, these patients have no identifiable risk factor. So that is a bit scary. And that is why it's absolutely important that when you reach those ages that require screening, that you should embark upon the screening, because you don't know those sporadic presentation. Those with the family history, you'll be more aggressive. And I would like to tell your listeners, one of the best the best person to examine your breast is you. You're going to examine that breast, young person, 1 week after the cessation of the menstrual cycle. And you will have a good idea, even better than a surgeon, of what is happening in your breast. And as soon as there is a change you notice, look, you better get at it right away. And not to prolong this too much, I'll give you a very important case. There was a 32-year-old girl who came to me and she said to me, Dr. Frey, there's a thickening right around my nipple here. You know, it's abnormal. And I look at it and it felt a little abnormal, but looks pretty benign. And I said to her, all right, you're 32. I'm going to send you for ultrasound. And you know, the ultrasound came back and said, look, this was normal. And in fact, they give a score. We score it on imaging of BIRAD 2. And I said, well, I don't think you need to worry. And she said to me, Doc, it wasn't there 2 months ago. Why don't you just remove it for me? And it was very simple. Right there in the office, I infiltrated, took it off, sent it for histology. Lo and behold, I was shocked myself. It came back as cancerous. So we were able to preserve her breast. And I believe, you know, she will have good, we run through the gamut of treatment. And I use that example to tell you that how important it is for that self-breast examination, better than any doctor examining you. Very important.
You know, you just lead me to bring Dr. Curlew in.
Absolutely, yes.
Because Dr. Curlew operates Radiology West. Not only does he do breast examination through this brand new Konin system, Koning, that he has, which is the only of its type in the Caribbean. But he also has the other type. I'm thinking what the other breast examination machines that we have been using over the years. You still have those, right? The one
Yes.
that presses on your breast.
Yeah, mammograms, yes.
Mammogram. I'm sorry. Forgive me. I don't want to call the wrong names, so it's best if I say it the way I'm saying it.
Sure.
Dr. Curlew, tell us, how busy is your office in relation to people coming in to do breast examinations? 1. 2, what are the imaging modalities that you have introduced that have helped Jamaican women?
Okay. Thank you, Janet, and good afternoon, everyone. So I just want to go back a little bit to Dr. Frey, who was talking about screening. And screening is very important. As he said, a screening mammogram or breast imaging is a woman who is perfectly healthy, feels normal, but is checking periodically every year, every 2 years, to see if we can detect any early signs of cancer that are there, but you're not going to be able to feel. And so there are 2 modalities for this. One is mammography, which has been around for over 50 years, which is an X-ray test. The breast is compressed, that's a squeezing. One of the reasons that some women don't like to have mammograms is that there is some discomfort with mammograms. And it's one of the things that, you know, maybe makes the utilization of screening lower than we might like, right? And I should add that, asking about how busy we are, I don't think enough Jamaican women screen for breast cancer. It's just a fact. And there are many reasons for that. You know, there are some of the myths and fears we talked about. Some of it is access, you know, having, whether some women can afford it or not, having facilities that can provide the service to the general public and so forth. But so what happens is that in October, which is Breast Cancer Awareness Month, we're really busy, and we'll usually run that promotion into November as well. And we do get, you know, good turnout, and women kind of see this as a time when, you know, it's a reminder to focus on their breast health, and that works out well. And then the rest of the year, it's not that busy. right? And I would love to see more women, you know, actively engaged in screening. So this new machine now that we're talking about, it's called breast CT, and it's a way of imaging the breast where you lie down on a table and you acquire the images by putting the breast through an opening in the table.
You have anything you want to show us?
Sure.
Good,
Well,
I'd like to see.
I don't have an image of the table, but I do have something of the pictures themselves. So let me tell you how it works, and I'll show you the pictures. So the woman lies on the table. The X-ray tube is underneath. It scans the breast, 7 seconds. The woman moves, puts the other breast through the opening, scans for 7 seconds, and it's done. There's no screening, there's no squeezing rather, and you end up getting a 3-dimensional image, which I'm going to show to you right now. And tell me if this comes up, please.
I'll tell you.
Sorry.
Let me read some of the comments. In the meantime, I see Tamika is saying that men have breast cancer too. Yes, we do know that, Tamika, but it's not as prevalent. So,
All right, can you see this?
Yes, let me add it to the stage. Yeah,
Okay.
there it is.
All right, so breast CT, no compression. We get 3-dimensional high-resolution images. The amount of radiation is quite similar to mammography. It's approved by the FDA, and it has some advantages in women in detecting cancer in women with dense breasts. Now, as you know, as a woman ages, her breast goes from more glandular tissue to fatty tissue. And the more fat in the breast, the easier it is to see the cancer. So unfortunately, younger women, it's more difficult to detect breast cancers. And this breast CT helps. We can also use a contrast injection with the breast CT, and similar to what we have with breast MRI, where we use the contrast to detect some forms of early breast cancer, that can work very well. And if you look at these images here, there are 3 panels. They're labeled, axial, sagittal, and coronal. So those are the 3 different dimensions. And then there's this, what's called a MIP, which is kind of a composite 3D image. You can see that the level of detail in this is quite good, and these markers here are zeroing in on a small cancer in these 3 different planes. Another image here, the 2 images on the left are conventional mammo, and the image on the right is a breast CT. So it's the same patient, and if you look on the image on the right, you can see that the area that's circled is an area of breast cancer that is much easier to see than what you're seeing on the mammogram. And what this allows you to do is to pick up very small, very early abnormalities with more sensitivity than you would ordinarily with regular mammograms. Here's another example which shows you the image on the left is without the intravenous contrast, and you can see the solid arrow is showing an area of abnormality, which is a tumor, and you give the contrast injection, and that area with the solid arrow becomes whiter. It takes up the dye and allows us to see it better, and the characteristics of that also guide us in understanding whether this is something to be worried about or not.
Okay.
And then last slide, the image on the left is an MRI. And I think this is the same patient again. So you can see that the area circled, they've gotten a dye and it's showing some enhancement there. With the breast CT, that you can see that the detail on that is quite good. And with the contrast, you're able to see not only the tumor, but these little white dots, which are called microcalcifications, which is one of the ways that breast cancers present. You can't see microcalcifications on MRI. So in a lot of situations, we're finding that this breast CT can replace breast MRI and give us a more comprehensive type of information. And then this is the last image just showing a pre and post contrast of a cancer with this arrow. So I'll unshare the screen and I'll go back.
Dr. Curlew, are you offering any special for women and men? Because I'm getting people even WhatsApping me now to ask me, if there is any information regarding men and breast cancer. I'm going to ask Dr. Frey to respond to the men and breast cancer, but I'm asking you to respond to whether or not there are any specials for the month of October for women who want to come in and test, particularly if they want to use this new machine that you have that does not compress the breast at all.
Yes.
I came into your office and saw it, and I was in heaven. I just want you to know that. I could not believe that a machine like that existed. I love it.
Women used to always say the mammogram machine must have been invented by a man, right? Because it's uncomfortable. And why didn't, a woman invent something else? Well, the guy who invented this, it's a man. But I think you can make him an honorary woman because he's really, made a contribution. For October and November, we're going to be running our traditional Breast Cancer Awareness Month special. We provide a 20% discount, and we're doing both modalities. So women who want to continue having mammograms, we're still going to give them that 20% discount. And women who would like to try the breast CT, we are also going to give them a discount on that as well. It's a more expensive test, and that's, it's a more expensive technology, and that's life. But we think it's still within, reason, and I think that giving those discounts will certainly help to make it more accessible to as many women as possible.
Well, I can tell you that my organization, Sarah's Children, is sponsoring at least 20 women who would not have been able to afford to do their breast cancer screening. We are going to be sponsoring about 20 women from communities that, they may not be able to afford it. Because I have spoken with a number of people who work in the industry, and they'll tell you that sometimes women come for the test, and when you smell the money, the money was under the mattress. That's how long they had to save to get the money to come to do the test. If there's anyone online who wants to sponsor a woman as well, a woman who would like to go and get her breast checked but cannot afford to, I'm inviting you to join us in that project. Dr. Frey, I have a journalist asking if you have any information regarding men and breast cancer.
Oh, absolutely. In fact, 1% of breast cancer is in men. So 99% is woman. Sorry.
Women. Yes.
Miss Still?
Yes, we're hearing you.
Yeah, sorry. So 1% is in men. And let me put it in perspective for you. Most of the work I'm doing now is breast cancer related. Sorry, a call came in. I tried to block him out. Since I'm here in Montego Bay, I only treated 5 men. And I can't count the number of women I've treated. So you can see, but what that tells you, men must be aware, just as women as well. And what are the signs in men that you're aware? If you see any abnormality in your breast, like a lump or any sort of nipple discharge or anything like that, you should have it addressed. As men get older, where their male hormones decreases, the breast enlarges. We call it gynecomastia, and that is physiologic in a sense. However, if you notice anything that is, abnormal with your breast, you should have it checked and addressed. And by the way, we image men as well. I've sent men for ultrasound and mammogram, as small as those breasts are. It works, and it can assist you depending on how they present and what you're looking for.
Yeah, we
Thank
get
you.
occasional cases with men.
Yes.
It happens,
Doc,
maybe every
doctors
year.
rather. There are lots and lots and lots and lots of questions that we're gonna try and cover some of them. So I'm gonna just go straight into questions now because we have 20 minutes to go. Oh my God. Yes, we have 20 minutes to go. So we are going to go ahead and answer some of those questions that we're being asked. One of them is, what is the cost of a mammogram and also for a CT of the breast?
Okay, good
That would
question.
be Dr. Curlew.
Okay, a mammogram is $11,000, and with the discount, it's I think 8,800.
8,800 for the mammogram. Mhm.
With the discounted price during the breast cancer awareness promotion, right? The breast CT is $25,000, and with the promotion, it's
20,000.
So it's twice as
Well, me I
expensive.
do the CT because I love the machine. Just so you know. Yeah, I really do. Doc, I came into that office and I could not believe that machine existed. Do you know how many years I've been doing mammograms and saying that we want something else? So I'm very happy that it's there and available for us women who would like to make a difference. Would like something different from what we
We've
have
had really positive feedback. All
from it.
the women who have had it, have remarked at how comfortable it is, how easy it is. This machine also allows us to do biopsies. That's going to be our next phase. And so, I hope that those women who are able to will try it and see. And as I said, in some ways, especially if it's a woman with very dense breasts, it may have some advantages in terms of helping to, detect smaller cancers.
Thank you. I see Tamika says painless is the way to go. While Dr. Sonia Nixon is on, by the way, all the way in Grenada. I believe she's still in Grenada, not on vacation somewhere else. And she's saying hello to you, Doc.
Whoa.
Yeah,
Hello, Dr.
she's saying
Nixon.
hello to you. I'm trying to see the questions, but I'm not seeing them on my I don't know why. Let me see if let me see if I can find some of those comments. Oh, why am I not seeing the comments? All right, therefore, how much for the test? I don't understand why can't post comments to some destinations. I don't know why. Let me see. If there is anyone who had a question earlier and want to just rewrite that or copy and paste that question. Okay, somebody just says, I'm just joining. What are the signs of breast cancer? That was discussed. Definitely, that was discussed. I don't know if Dr. Frey wants to answer that again. What are the signs?
Yes, just briefly. First thing you want to do, the commonest presentation is a painless lump. And I want you to know that, in fact, this is one of the sinister thing about it. Most people, if they have a lump and it's not paining them, they are not going to be seeking any sort of medical consult. But a painless lump is a sinister sign. Any sort of inflammation within the breast, any nipple discharge, and the nipple discharge, that is the one that we are concerned about, although it is not 90% of the time it's not due to cancer, but it's a bloody nipple discharge, then you want to do that. But any sort of nipple discharge which is not milk, you should have it addressed and addressed properly. There are different pathology within the breast that can cause nipple discharges. You should have it addressed by your GP and go through the necessary things that are there. And sometimes there is some patients can present with like eczema type, like a sort of dermatitis at the nipple. That one not so common, but if you notice some
what is it? It's itching?
yeah, itching and sort of flakiness around the nipple. It is something called Paget's disease, which you see in older women. And sometimes you can go to a doctor and they might give you a steroid cream and it will settle down. But if it comes back, you should have it biopsy. And if it proves to be Paget's disease, usually there is cancer there in the breast as well. So in summary, I would say, I mean, breast pain by itself usually don't really cause there's a condition called inflammatory breast cancer, but that's not so common in Jamaica. But anything you see abnormal there in that breast, abnormal thickening, anything like that, it's very important that you should have it addressed. And let's say you're a woman who is in advanced age, and all of a sudden, without any reason at all, you found a breast abscess. Then, you know, one should be thinking that, well, they would go to the doctor because it's painful. And usually in those situations, when you drain that abscess, you biopsy the wall of that abscess cavity. And in the older woman, you might find something there as well. So anything that you see that is abnormal, it's very important that you should have a consult and have that addressed. That is the way you're going to be able to detect these things very, very early.
Thank you, Dr. Frey. We're not going to get any more questions in if we're not careful. Does early menstrual cause breast cancer?
Well, all right. There is a risk factor, which is really a statistical risk, where there's a long exposure to the female hormone estrogen. There is a statistical risk that it increase. In fact, that's one of them we put in our computer model to determine the risk. So early menarche, late menopause is going to give you a longer exposure to estrogen, and there is a correlation there, but to breast cancer. So yes, that's the answer. And there are certain things that cause long exposure to estrogen that increases your risk. And one of them is not having children, not breastfeeding. That increases your risk. So people who have children and breastfeed, statistically, there is some sort of protection there as well. But, one has to be careful how you weigh these statistical analysis. Mm-hmm. But yes, from a scientific perspective, yes, the estrogen plays a role. And just to mention while we are on it, being obese, fat can produce estrogen as well. And that by itself, have a slight increase in your risk. Now, what that means is that if you have a familial history, you have the genes, and you have these other risk factors, then what you are doing there is increasing your chance of getting breast cancer. And that's very important to understand how those two blend in as well.
Wow, that is a lot. I've learned so much just from that menstrual thing just now. Lurleen Craig says that she's now going through radiation, going to see her chemotherapy doctor next week. But she says just thinking of doing the mammogram alone, her breast is already paining. So psychologically, it's having an impact on her, each time she's ready to go to the doctor. Christopher Thomas, I'm going to try and get your question answered. I'm coming back to you. Dr. Morris, you haven't spoken much since you spoke earlier. I mean, how does one even get over this?
Right. So it's something that is naturally very difficult to deal with. It's important when going through these things to have as much support as possible. Generally, that support should come from your family, but there are some instances in which women may feel a bit isolated. So we generally recommend joining some type of support group. Mm-hmm. Which they do have in Jamaica. I know of some in Kingston. I would have to check about the Montego Bay support groups because I'm not too sure. But definitely support is important. And most of the time your oncologist or your surgeon can direct you to getting the necessary support that you need. because it's important that you have someone that you can share your burdens and your feelings with.
Mhm.
So it's very important for her to seek support. And we are available. Our psychiatric department at the Cornwall Regional Hospital is available. If anybody needs support, please, you can contact me and I can guide you to our psychologist, etc., depending on what you may or may not need. But generally, support is something
I'm
that is
so happy to
necessary.
hear this, Dr. Morris, because I did not even know that was available to pay to people who
Yes,
are going through this. I never even knew that this
definitely.
psychiatric department would be able to
Yes,
offer that kind of service. So thank you very much. This question is for
most
Dr.
certainly.
Curlew, reposted. Question to Dr. Curlew.
Mhm.
How many, this is a journalist, Dr. Curlew. I'm sorry. Maybe he should call you after and ask you, but he's asking you online here. So you might not be able to answer. How many women have come to Radiology West for screening from January 1 to September 30 this year compared to last year? I know you already said that enough women are not coming outside of Breast Cancer Awareness Month, but you want to expound on that?
Okay, so I can't tell
You
you
can't really,
last year and
you
this year,
won't know.
but I can give you a rough idea.
Okay.
So on an average month that's not Breast Cancer Awareness Month, we'll probably do, I would say, between 120 to 150 mammograms in the month.
Per
And
month.
per month.
Mhm.
And so, it works out to about, 6 a day, something like that, on average. And during Breast Cancer Awareness Month, we will do, 15 to 20 mammograms a day. So that will be, 300 to 400 mammograms for the month.
For the month.
But if you look at that, I mean, yes, there are other places who provide mammography in Montego Bay. There may be 2 or 3 others. I don't know what their numbers are, but if you look at those numbers and then you look at the potential population of women who are over the age of 40 who should be screening annually, the last figures that I've seen, the percentage of women in Jamaica who screen, I think, is less than 10% of the eligible women by age. It's still very low. So we need to really find ways to increase that and make it more accessible.
That's why I do this. This is why every single year, at this time of the year, I make it a point of my duty to try to help to sensitize people as to the importance of going for early detection. Go get your breast tested.
Mm-hmm.
And if you can't afford to, there are organizations like Sarah's Children willing to help those who can't afford to. The next question is whether or not their health insurance is able, people with health insurance are able to get their tests done. And I'm thinking that's a yes, but you can tell me whether or not that is so.
So mammography is covered by health insurance. Breast CT, because it's still so new, we're still in the process of having that approved by the insurance companies. We've submitted all of the paperwork and the documentation and the approvals, in other countries and so forth. And we are waiting for them to, approve the study. So at this point, a woman who wants a breast CT will have to pay for it up front and then seek reimbursement from her insurance company. I'm hoping that over the next couple months that this will change and it will also be on the,
Okay,
approval.
but the mammogram is on, but the CT, breast CT not on.
Because it's still in
new.
the normal process. Exactly.
Okay, fine. Understood. So Tamika, I hope we answered your question for you, even though you said no pain, no gain. Or you said it's better if you didn't have any pain, something like that. Carlene is asking that, she's saying that the percentage is very low of women who are being tested. Does the government provide it as a part of basic care? Maybe Dr. Frey could answer that.
Yes, in fact, we have a mammogram unit at Cornwall. So we are able to offer some patients, mammography, but on a large scale, not as yet, but we do. And also, while I'm at it, we have a breast cancer support group at Cornwall as well that you can, tap into as well. That was
Wow.
mentioned earlier, so I wanted to plug that in.
All right. Somebody's saying that menopausal women should always do a 3D mammogram with an ultrasound due to the denseness of the breast tissue. Is that a case? Is that true?
So there's a general correlation that the younger you are, the denser your breast is. But there are also women who are middle-aged and older who still have very dense breast tissue. And there are also younger women who tend to have fatty breasts. So it's not so much a function of age or pre or post-menopausal, but women who have very dense breasts, we do recommend that they have ultrasounds to supplement the mammogram because they're provide another look, another possible way of diagnosing an abnormality. So we do recommend in women with very dense breasts that they have an ultrasound as well. With the breast CT, I suspect that we may not, if we're going to use that as a screening, I suspect that we will need fewer ultrasounds, but I can't swear to that because we don't have enough experience with that yet. But in general, very dense breasts, in general, younger women, ultrasounds are recommended.
How long can you stay with breast cancer? I'm thinking, how long can you live with breast cancer is what this person is trying to find out.
Breast cancer it's one disease, but it's not one disease, right? In the sense that, as Dr. Frey said, some cancers have various receptors. There are some that are very aggressive, and even with the best treatment, the outcome is not as good as others. And there's other breast cancers which respond better to treatment and have a higher cure rate. So, you might know somebody who, had a good outcome with breast cancer, and you meet somebody else and they don't have as good of an outcome because they had a very different kind of breast cancer. So it's sometimes very hard to, this is why they do the testing that he spoke about. You test the receptors and the hormone things, and that now gives you a sense of how aggressive this is and tells you, okay, this is the appropriate treatment to have the best chance of curing this cancer.
And White Rock Villa, which is located down in Great River near to Reading, that side, is asking, I believe she was asking Dr. Frey if you can join them at their wellness retreat. I like that. So Christine, as the Dr. Nixon is online, as although she's all the way in Grenada, she has been putting in a lot as it relates to the discussion. Thank you, Sonia. No wonder I love you the way I do. Christine Mazuka says, I will answer the question. While breast cancer can't be completely prevented, risk can be reduced through healthy lifestyle choices like regular exercise, a balanced diet, limiting alcohol, and regular screenings for early detection. So we have some Facebook doctors as well. That's my friend Christine.
And I am in agreement with that statement.
I love her to death, and I appreciate the fact that that she was able to contribute with that. All right.
That's a profound statement, Janet. Yes. Very complete. I like it.
Very much so. Very much so. Pauline Allen, and this is the final one this evening, guys. I know someone who was discouraging her friend not to do annual mammogram because their mothers didn't do mammogram and they did not have breast cancer, which I had to debate her with. Can you imagine? Your mother didn't do mammogram, so you not have to do mammogram because you can't get breast cancer. What a myth. No, that is carelessness. I don't know if I would call that a myth. like I would call it carelessness. Yeah, you're being careless when you decide to make such statements or have such thoughts. I think it's backward thinking. What do you think, lady and gentlemen?
Yeah, I
I
think
mean, we've
it
all
is.
said it.
Yes, you
I
you
know
have to do your
mammogram is
screening.
necessary.
Yes.
I can't. I mean, I
Absolutely.
can't begin to thank you guys for coming on. You have done a fantastic job. This was a very interesting conversation, and the people are saying it online. I think that even after we leave here, we will be able. Persons are going to be watching this interview and talking about it. My next interview next week is with Dr. Arusha Chambers and Dr. Shasha Williams. And we're going to be talking about skin bleaching and how that is affecting us as a nation. I think we might have Dr. Janine back when she's not in her car when it's dark. Because let me tell you something. I know that this is having this serious mental health issues we're having in this country as it relates to skin bleaching.
Most
Yeah.
certainly, and that's a very interesting topic.
Yeah, so we're gonna be talking about that, and of course, we're gonna have to touch on mental health because next week is also Mental Health Week. So this is a month when we're gonna be talking a lot about our health and wellness because it's very, very important for a country to have a productive group of people. That nation must be a healthy nation. And so that's where I end this evening by thanking Dr. Delroy Frey, Dr. Janine Morris, and Dr. Conrad Curlew for accommodating the discussions around breast cancer and its impact on the Jamaican society, because it's not just women we spoke about. We did speak about the men. We gave them a little bit, but we did speak about the men.
You're most welcome.
Thank you.
Thank you so much for having me.
A pleasure, a pleasure, a pleasure, a pleasure.
Most welcome.
You
Hi,
don't have to
Dr.
leave just
Nixon.
now. Let me just end the stream. I'll come back to you. And